Dr. Greg Forrest, Clinic Director at the Pain and Brain Healing Center. And you have this video for one of two reasons. You're either about to begin care, considering care, or you've just started care. And I want you to keep this video on hand because this has a wealth of information that will help you heal. It's very important for healing. Now, I'm a board-certified chiropractic neurologist. I'm nationally certified in acupuncture. I'm certified in applied herbal sciences and functional medicine. I specialize in a natural functional medicine approach to your health problems. Functional medicine versus disease care. This is about optimizing function so you can heal. A great textbook for this is my bestseller on health. It's called Why We Hurt. It's an excellent guide. It's 400 pages. It looks at all the different subject matters from dysbiosis to mitochondrial dysfunction, maldigestion, malabsorption. And what's all that about? Well, that's what we're going to talk about. So if you are about to begin care or you've just started care, we have the answers. Now, as I've mentioned more and more times to my patients, you have to have the courage to think outside the box if you want to get healthy. You maybe heard this before, but if you go to a doctor, you are inside a box based on their educational perspective and prejudice. If they're trained in just drugs and know nothing about functional medicine, nutrition, nutritional supplementation, and herbs, they're not going to be able to answer your questions. If their view about healthcare is that you need to take, if you have chronic pain, joint pain, myofascial pain, fibromyalgia, you need to take Lyrica, immune suppressant drugs like Remicade that can screw up your immune system. If that's their perspective, you're not going to get a natural functional medicine perspective out of them. You're going to be stuck inside their box. Plus, if you're following the dictates of your insurance company, because the insurance company say, we only pay for TSH, we're not going to pay for whatever. I mean, they're going to say what is medically necessary. It's these two aspects that set up what's called the standards of care and what's medically necessary. And I try to emphasize to my patients here, whether, again, you're about to begin care, you're thinking about beginning care, or you've just started care, that what we do here is not what's, quote, medically necessary, but what's necessary for your health. We run the tests to get to the underlying causes to fix the underlying issues. So you have to have the courage to think outside the box. Now, if you're going to get better, you need to have the courage to fight. And I tell all my patients, you need to be able to have the ability to say, I will fight. I stands for the invest, and you need to invest in yourself. You need to invest in some of you that have already begun care, have already made that decision. You've invested the resources, and now you need to invest the time. You need to follow through to get yourself better. And we're going to be focusing on food. Well, first you got to refocus your life. And if you've started care here, you've already done that. You're ready to refocus your life. We're going to reinvent your life. We're going to bring you to a really healthy state. That's our goal. And that F stands for food. You need to understand that there's nothing I can do to replace. If you're eating junk food, you're going to get up with a junk life. I mean, junk food creates junk health. You have to focus on your diet, and I will help you with that. I will help you find food allergies, food sensitivities, maldigestion, malabsorption of your diet, just whatever it takes to get you healthy food digested and absorbed and properly assimilated. The second I that we'll be focusing on in your care here is the immune system. The immune system is what guards against infections and cancer and all kinds of things, and it needs to be balanced. And when it's not balanced, it has a hyperinflammatory state. You got more inflammation. That forms trigger points and muscle nodules, stiffness, ache. If you're suffering with chronic pain, chronic myofascial pain, fibromyalgia, chronic fatigue of the body, then you have chronic systemic inflammation that cannot be taken care of by taking drugs. You can't just take a lot of NSAIDs and knock this out. You create too many health problems in liver and kidney and tissues to do that. You need to go after the underlying cause of the inflammation. So, and then if you're suffering with brain fog, lack of focus, mood dysregulation, anxiety, insomnia, again, there's inflammation affecting the neurons. So in the muscle tissue, pain, achiness, fatigue, and the nerves, the neurons, lack of good neuronal health. We're not releasing the serotonin, and that's why I want to take, I'm taking an SSRI for my depression. I'm not releasing enough adequate dopamine. I'm not getting focused properly. So inflammation, and sometimes infection plays a major role in that. So we might peel down eventually the fact that there is some chronic infection, and we'll talk about that. The other thing is central to your recovery is the GI, gastrointestinal, also your genes. We have to really find out genetically what you need. You may need more B6 than someone else. You may need more folic acid for methylation. Genetically, you're different than your spouse, than your neighbors, and we need to determine that. But the GI is huge because that's like the roots of a tree, and if you don't have good GI health, and if you're here seeking recovery from chronic illness, chronic pain, chronic fatigue, you can bet dollars to donuts that you have some GI issues. You also may have some symptoms. You got GERD, you got IBS, you got reflux, you've got GI symptoms. Well, then there is a problem in the GI tract. And why is that so important? Because 70% of your immune system lies in your GI tract, and if there is a problem here, you're activating the immune system, activating inflammation. H, hormonal balance. You've got to have good hormonal balance. We'll be looking at thyroid. We'll be looking at laboratory tests for good thyroid function. We'll be looking at adrenal stress tests. So we'll be looking at hormonal balance, female hormones, male hormones, very important. T, this is the last underpinning of your health recovery, to the fight toxic. We live in a toxic age. You handle a receipt from a cash register, you get BPA. There's lead in the air from China's coal-fired power plant. So, I mean, we're awash in chemicals and heavy metals. It's not whether you're exposed. I mean, it looks clean and clear and everything looks fine, but there's a real hidden toxicity issue in our food, our environment, and it's all about how well you're clearing those things. And we'll talk, and we can all these things will be tested for. All these things have to be corrected, because that's the way I'm going to get you better. That's why it's a 6-month journey. So if you really want to heal the chronic illness, the sense of flu-like symptoms, pain and fatigue, we are going to fight through that. And if you've set a course, you've already joined up to do this, we're going to get at this for you. If you're thinking about it, if you really want to get better, you have to make the decision to fight for your health. Now, many are saying, oh, I've been to the medical doctor and I've had tests and they've said it's normal. Well, maybe the AST/ALT was on the upper edge, or even a little bit into abnormal, but they, what can they do? Transplant a liver for you? See, these are enzymes for liver. And the number one cause of liver disease today is something called NASH. It's a fatty infiltration of liver because of inflammation and chemicals and improper diet. And these enzymes start to elevate when your liver's not healthy. Well, the liver, it's what helps you to live. That's what we call it, the liver. I mean, and you need a healthy liver. So if you're starting to get abnormal liver enzymes out here, we need to really address that. Hemoglobin A1C, that tells me that you're heading towards insulin resistance and diabetes. We need to address that. So in the past, they've done very minimal, non-specific tests. We do very specific functional tests here. If you've started care here, you maybe already started doing some of the kits and laboratory tests. You've had your blood drawn. If you haven't started care here, what we do here that's different is actually run multiple, very specific, functional laboratory tests. And I understand how to interpret those, not just look at, okay, are you within the statistical average, so you're normal, thank you very much, goodbye. No, this is a much more in-depth look at laboratory medicine. Now, if you've got chronic pain, fatigue, brain fog, there is signs of a loss of cellular energy and vitality. If you're achy, forming trigger points, if you have brain fog, if you are just get fatigued throughout the day, we need to restore cellular energy and vitality, and that looks at mitochondrial function. So we'll be looking at that. Now let's take a little peek at that. So the key to your recovery here, now that you've begun care, is to look at cellular health. This is a quick diagram of a cell. You've maybe seen my pictures before in other videos. And what we'll be looking at in your care here is to optimize energy production in the mitochondria. These are little organelles in every cell. This could be a muscle cell, could be a brain cell, skin problems, it's in a skin cell. And for every tissue to be healthy, you got to produce lots of ATP. You produce your weight in ATP. This is the energy molecule. So a lot of your care here I'll be talking about is finding out what is affecting the mitochondrial function. Chemicals affect mitochondrial function. Oxidative stress, free radicals affect that. Also insulin resistance. Some of you have heard of maybe insulin, about diabetics having to shoot up insulin. Well, long before that, we get something called insulin resistance. What is insulin? It binds to the receptor site here, opens up a gate, in comes calories. You take those calories and you burn them, you create energy to burn, okay? And then you also have to get other micronutrients through, because this inner membrane that produces ATP is dependent on B vitamins, magnesium, antioxidants, huge. Antioxidants play a major role in protecting this inner membrane. And I run tests for you to find out what it is that we need to fix. So use this video to help you understand what I'm doing for you. Insulin resistance. And how will I know? I'll do hemoglobin A1C. Fasting glucose is helpful. Triglycerides are helpful, but also fasting insulin. Is this really high? It's like a sledgehammer beating away at the muscle cell, brain cell, trying to get the glucose in. And as this starts to weaken, as we start to weaken here, your body creates more insulin to try to drive the blood glucose in. And as this is getting slowed and weakened because of inflammation and other chemicals, that's another thing in our environment today. A lot of the chemicals today disrupt the insulin receptor. So what happens is that we get increased blood glucose. Our liver says, what am I going to do with all this? It turns it into triglycerides. Triglycerides are then stored as fat around the middle, and we get apple-shaped. I have all this stored energy, but I'm fatigued. I'm weak. I'm fatigued, and I have brain fog. Insulin resistance is huge. We'll be looking at that in multiple ways through multiple lab tests. Now, we also will be looking at thyroid. All my patients get thyroid testing. We'll be looking at that because free T3 stimulates the mitochondria to produce ATP. So we need to make sure that we know why you're losing cellular energy and vitality and aren't keeping your tissues healthy. So we need to run the right tests to get the right answers. So let's look at some of this. First of all, we're going to be running very specific thyroid tests. Now, usually maybe just a TSH is run. That's what stimulates the thyroid. The thyroid then puts out T4. Sometimes they look at T4. But here's the key. Your liver, kidney, GI cells, they convert T4 into the T3. And T3, a small portion becomes unprotein bound. It then enters the cell. It stimulates the mitochondria. Out comes the energy. It's vital. So that's a lot of people wondering, like, do I have hypothyroidism? Well, this may be normal, but you're not converting into the T3. And I have diagrams to give you. We'll be looking at your blood tests. You may not have sufficient levels of T3, even though your medical doctor had done TSH and it was within normal limits. So we need to look at this whole thyroid axis. Now, this is the gas pedal for cellular energy. If you have a gas pedal, you need a brake. That's called reverse T3. Now, reverse T3 blocks the receptor for free T3, so we can't stimulate our cells to produce energy. Now, this reverse T3 is increased under times of stress, increased cortisol, just many different things will increase this, and this is never measured. Now, I measure this with my patients to see, because there's a ratio between these two that have to be proper, and if you don't have a proper, you need to have really basically 10 accelerators for every one brake. And most of my patients are running 3 or 5. They don't have enough accelerators to brakes. Then we also look again at insulin resistance, health of the cells through insulin resistance, deficiencies in mitochondrial function. Mitochondrial function, we'll be doing, you'll be getting a urinary organic acid profile. If you already started as a patient, you may be doing the urine test. You collect the urine in the morning, and then you'll be getting the test results back. And there we'll be looking specifically if chemicals are damaging your mitochondria, if heavy metals are damaging, if inflammation, oxidative stress, free radicals, you need certain antioxidants, and I'll be able to tell you you need more fat-soluble antioxidants, water-soluble, what specific type, gamma-tocopherol, N-acetylcysteine, vitamin C. We'll be looking at how to save the mitochondria. And if micronutrients, B1 is deficient in the Krebs cycle for the mitochondria. So the urinary organic acid profile we'll be looking at, that'll be looking at mitochondrial function, toxicity issues, methylation issues. Do you need more folic acid, B12? So multiple different things, the different lab tests. Now, one of the things we look for is thyroid antibodies. And I can't tell you how many patients that come in with chronic muscle pain and ache and fatigue, and no one's running thyroid antibodies, and they had Hashimoto's disease. If you think you might have low thyroid, but your TSH has been normal, this is the most, 90% of all hypothyroidism today is Hashimoto's. Now Hashimoto's, as I probably explained to you, or will explain to you, is nothing wrong with the thyroid. The thyroid is fine. It's the antibodies you're forming from the immune system that's killing off your thyroid. Now medically, they just watch this die as they give you more and more of the synthroid levothyroxine and never check to see if you're converting them into the active, bioactive T3. So, and if you do have elevated thyroid antibodies, Hashimoto's, I need to look for the underlying cause of that. Many times that's chronic infections, heavy metals, GI dysbiosis. So now if you're here at the clinic, most patients have some pain, myofascial pain, or even widespread fibromyalgia. We're here for chronic fatigue and brain fog. All those show decreased cellular energy, decreased ATP. If you have that, you're going to have the formation of pain-causing neuromyofascial trigger points. So I want you to understand what trigger points are. Trigger points form in the muscles and soft tissues, tendons, but mostly muscles, ligaments. You call them muscle knots. They send signals out, and it hits your brain, and you go, ow. And it makes the muscles stiff and achy. And if you have fibromyalgia, you've got tons of them firing in from all over your body. If you have just headaches, you have the suboccipital muscles firing in, or TMJ. If it's shoulder pain, it's just from the rotator cuff muscles firing into the brain, giving you. We need to remove this to normalize the myofascial tissues. Now, here's the thing you need to understand. Many people think that I don't have any pain, so I have no problem. I was bending over, getting groceries out of the trunk, and all of a sudden my back went out. The back didn't go out. So when I ask patients, where did your back go if it went out? Out for lunch? What happens is that we have compromised muscle tissue where we're just kind of hanging by a thread, and eventually we do something that stresses the tissues out. The trigger points finally get more and more involved, and they fire at a higher rate, and then we finally perceive it. I've maybe already explained this to some of the people already as patients, but if I stick a pin in you, you don't feel it here. It goes to the spinal cord, synapses, sends a signal up to the thalamus, synapses. Then when the signal gets up here, you go, ow. And there are a whole bunch of things in the brain that can fire down and suppress the pain. So just because you're not, your spouse isn't having a lot of pain, they may have a lot of myofascial trigger points that is causing stiffness, tension, muscle tension, even psychological tension. These trigger points can also spread through firing in the spinal cord and going up so many segments and down so many segments, and this is spreading the pain. And this is so we need to disrupt these trigger points with myofascial therapy, acupuncture, and we need to make the tissues healthier. Now this whole process we're talking about here is something called neurological windup. The body, the pain spreads, and we need to start shrinking that pain. And that's what our patients find, is that as they undergo care, the spreading the pain gets less and less and less, and now it's back to the original area, and then we get rid of that, and boom, all their pain is gone, and the tissues are healthier. So what's the underlying cause of these myofascial trigger points and myofascial pain that you may be dealing with, or chronic fatigue? Is this chronic inflammation, oxidative stress. Now, we need to go after the chronic inflammation, oxidative stress that are causing the chronic pain, the chronic fatigue, the flu-like symptoms, and whatever you name it, fibromyalgia syndrome, chronic fatigue immune deficiency syndrome, myalgic encephalomyelitis, the European term, which is a better descriptive term, whatever you call it, this is the underlying cause, and this is what you're going to go after here at the clinic. So, the testing we do looks at all these different factors. Chronic pain, chronic fatigue, insomnia, anxiety, flu-like symptoms. So we're going to do tests to look for maldigestion, malabsorption. The digestive stool analysis, the blood test and the urinary organic acid profile tells me if you have this. And if I talk about this, then you need to work with your digestion absorption. And that can lead to nutritional deficiencies. And if you have nutritional deficiencies, then we're going to have to help with restoration of these nutritional deficiencies. Dysbiosis. What is dysbiosis? This is huge. Most of my patients, most Americans have some dysbiosis. This is about imbalanced gut flora. We'll talk about that in a couple moments. That leads to leaky gut. Maybe you've heard the term leaky gut, maybe not. But leaky gut is the fact that there's been some inflammation, irritation, and the cells of your GI tract aren't tight. Proteins can leak through, partial proteins, and that your immune system reacts to. Corn protein, dairy protein, it can partially digested, leak through the GI tract. Now you start having food allergies and food sensitivities. Then we have insulin resistance, I've been mentioning. We have to look at specific tests for that. And then hormonal dysfunction, thyroid, adrenal, we need to do tests, and we need to look at that. Also, there's something called blood flow changes, and that is huge, and I'll explain that in a moment. But these are all the different tests that I'll be running to look at that, to fix these problems, to get rid of this. This is an iceberg, all right? This is the waves. This is the symptoms. And you can chip away at all these symptoms, but unless you get at the underlying issues down below here, it's going to sink your ship of health. This is the difference that makes the difference in the care we do here. Now, we may start to drill down and get a little deeper in your care because we may find that you have autoimmune disorders through an anti-nuclear antibody test. You have Hashimoto's, lupus. We'll have to address the underlying causes of this autoimmune disorder. A lot of it, the reason you have an autoimmune disorder is the toxicity issues, chemicals and heavy metals that are stimulating your immune system, creating this whole hyperinflammatory state. So we need to remove the lead, the mercury, and the chemicals, and there are ways that we nutritionally can do that. Now, if you have these issues, that can suppress your immune system, and now we have chronic bacterial infection. And there are tests that I can do to see if you have a chronic bacterial infection. You know, like Lyme, you've heard of many people who have Lyme disease, chronic Lyme. Well, a lot of times there's chronic upper respiratory issues like mycoplasma, chlamydia, pneumonia that create chronic sinusitis, rhinitis, and there, in one study, I think it's 60% or 80% of all individuals with the chronic fatigue and pain had chlamydia pneumonia. So we need to go after those issues. Viruses are huge in chronic fatigue and chronic pain, so we'll be investigating if these are an issue through specialized tests like a CD57 count, looking at your white blood cells, looking at different things that give an indication that we need to help your body fight off this chronic infection. Now, toxic issues, chronic infection, all this stimulates a hyperinflammatory state which creates hypercoagulability. What is that? Maybe we did the blood test already and I've talked about this fibrinogen. Fibrinogen is a marker for hypercoagulation. If our blood is running thicker, it's not getting through. These capillaries that run through your muscles and through your brain are smaller than a hair. Smaller than a hair. And if your blood is running thick, then it's not going to perfuse. Then you have fibrin formation along the capillary bed. We don't get oxygen through it. The tissues suffer from low oxygen states, low nutrient states, and we feel pain and fatigue. So we use certain specific nutrients to help reduce that, like lumbrokinase and such, and you need to know if you need that through laboratory testing. So we'll be looking at blood flow. Now, this is a very important section. If you're under care here or thinking about care, this is huge. This is like the roots of a tree. The roots of a tree extract the nutrients so the leaves can grow and be healthy. This is the roots of your tree. Extract the nutrients so your brain and muscles can be healthy. So here's digestion. You bring food in, you produce hydrochloric acid, and then mucin to protect your stomach lining. If you produce enough hydrochloric acid, that's like down to a pH of 1.5, 2. It would eat right through this desk. But your stomach produces enough mucin to protect it. Here's the problem. You may have maldigestion, malabsorption because you're not producing enough hydrochloric acid and you're not producing enough mucin. So then we have to heal your stomach first. I've had patients who hardly could take any supplements, everything that bothered them. They had reflux GERD. We had to heal their stomach first in the upper GI, so we could get them to start being able to handle better foods, better supplements. This is a little sphincter here. Actually, if you have GERD, reflux, that's actually caused by not having an acidic enough environment because this senses the acidity. And when the acidity gets low enough from enough, what I'm saying is that with GERD, usually you're put on a drug that blocks your ability to produce hydrochloric acid, which then means you're not digesting at all. I have handouts on the importance of stomach acid, but you need to be able to produce enough hydrochloric acid to digest your minerals and protein and shut down the sphincter so things don't reflux. And by taking Prilosec and different drugs, proton pump inhibitors, you're just shutting down the total ability to digest. And the duodenum and then the pancreas. Be looking actually at pancreatic enzymes. Are you getting enough production of pancreatic enzymes to digest your food? And then we look at in the digestive stool analysis and the urinary organic acid profile if you have a good balance of gut bacteria. In the small intestine through the urinary organic acid profile, and in the large intestine through the stool analysis. So I'll be discussing this with you based on your laboratory tests. Because 70% of your immune system lies here in your gut. And if there are bad guys growing here, they're going to stimulate the immune response and you're going to have more inflammation throughout your body. There's a gut-brain connection, a gut-muscle connection by this hyperinflammatory state. This is huge in all my patients. And if you're getting irritable bowel, inflammatory bowel disease, constipation, diarrhea, all of this shows that you don't have good bacterial balance. And that needs to be found out. And without good bacterial balance, we can actually get, with dysbiosis, leaky gut syndrome. And now we're bringing in partial proteins, and we're reacting to them like food allergies. Or we're creating immune activation food allergies. And that can give you tons of symptoms. So we need to make sure that you are digesting and absorbing, and you don't have dysbiosis, because with an imbalanced gut flora, leaky gut, it's very difficult to get better. So what we're going to do for you here is you've maybe gone through a health history, we've done the neurological exam. If you haven't started care, we're going to do this, a full hour exam, and then based on this, we look at these different tests, from comprehensive blood tests, which you may have already had blood drawn, the thyroid test, the digestive stool analysis test, mitochondrial test, urinary organic acid, food allergy test, toxic metal test. All these will be looked at to make sure that we get you better. So with your care here, we're going to look outside the box. We're going to run the right test for you. We're going to then get to proper 3R care. My 3R program, we're going to identify what's wrong and remove it. If you have heavy metals, toxic chemicals, we're going to remove that from your tissues. If you have dysbiosis, imbalanced gut flora, we're going to remove that. Then we're going to find nutritional deficiencies based on your genetics and your diet, what is missing in your diet, and we're going to restore those nutritional deficiencies. Then we're going to stimulate repair. How do we do that? We have myofascial care, structural care, traditional Chinese acupuncture, laser, microcurrent, brain therapy. There's articles that we'll be giving you on brain therapy. Brain therapy is huge because the brain runs it all. So we need to be able to stimulate a balanced, healthy response. As far as brain therapy, we know that when we get the brain balanced with more theta activity, we're getting a better healing state. When we get out of that stress sympathetic state and more into a parasympathetic state, we get into a greater healing response. So 3 R's: remove, restore, and repair. And if that makes sense, then you're going to want to begin care or continue with your care. Just make sure that we're going to cover all these. You need to continue on that. So if you have chronic pain and weakness, we're going to be getting rid of the trigger points with myofascial release and metabolic therapy. We'll be using trigger point therapy, acupuncture. All my patients, I like to get them on the Phoenix Rehab system. It comes in this box, and it contains a platform with interchangeable digits. And what this does is like thumbs that will actually put trigger point therapy pressure to the muscle knots. It comes with a guidebook and a DVD that explains exactly how to do this. So we're going to want to help you remove those trigger points while we're getting the tissues healthier. Trigger point therapy, acupuncture. I use acupuncture, very helpful. We want to get rid of the myofascial trigger points, lower the systemic inflammation, improve any insulin resistance, oxidative stress, optimize mitochondrial function, hormonal balance, improve your diet, remove food allergies. We're going to fight for your health. So remove what's causing harm, restore what's deficient, stimulate repair through all the different means that we do. So for you that have already started care, I want to congratulate you in making an excellent decision. I want you to use this video however you need to go back and see the different aspects, whether it's digestion or mitochondrial resuscitation, whatever we've been talking about in the clinic. Use this video for that. We'll decode the mystery of your chronic illness. If you haven't begun care, share this video with your spouse, friends. Get an understanding of what we do here. And I know if you've been suffering with chronic pain, chronic illness, flu-like symptoms, chronic fatigue, you need to take a different route. We'll decode the mystery of your chronic illness. We'll fix you. So, have any questions? If you haven't begun care, let's get you back in. Let's go through the consultation, explain things. If you're already an existing patient, make sure I answer all your questions that come up on this video. Again, I've got Dr. Greg Forrest, Clinic Director here at the Pain and Brain Healing Center. And I want to thank you for watching this video.